My name is Jillian Parker. Welcome everyone this afternoon. I'm joined by, that's Dr. Michael Quartuccio. You see there, he is an endocrinologist for Rochester Regional Health, and we're going to be talking about diabetes this afternoon. Dr. Quartuccio, how are you?
I'm doing well. Thank you for asking. How about yourself?
I'm doing well, except for the snow that's been falling outside today.
In Western New York, if you don't like the weather, wait 15 minutes, right?
No, and a lot of people actually, we've been talking about, I know working out is a huge part of diabetes. If you're a diabetic, being active, obviously this isn't the best weather to be outside in right now, so possibly a struggle. How important is it for them to find that time to exercise?
It'll vary based on each person's a little bit different, but for the bulk of the people, exercise really does have a large impact on glucose. And I've had many patients kind of comment that the fact that they've been less active, they've seen their sugars rising a little bit higher. So it's getting a little bit creative. If you live in a house or a building with stairs, it's even just walking up and down the stairs. It doesn't have to be vigorous exercise. There's videos available online, there's YouTube, different sites. I know the local YMCAs are actually posting some video on YouTube as well. Honestly, even lifting soup cans, as strange as it might sound, it's little weightlifting like that actually can make a big difference, because it really can lower those glucoses. When it's nice out, going for a walk, you can be bundled up and still go out for a walk. You want to maintain the social distancing, so obviously, staying 6 feet away from others. But luckily, especially people that are living out in the more rural areas, it's usually pretty easy to do. So unfortunately, going to the local gyms isn't possible right now, but it doesn't mean that you can't still stay active. It's just getting a little bit more creative.
Right, and those are some good tips. Is there a recommended amount of time per day, per week?
Yeah, so most of the organizations, like the American Diabetes Association, recommend at least 30 minutes of moderate intensity exercise 5 days a week. And by moderate intensity, they usually mean that you're working hard enough that you can talk to someone next to you, but you can't sing. So you want to be pushing yourself a little bit harder. So again, going for a walk, you should be kind of needing to take a breath every few words just to show that you're working hard enough, but certainly anything is better than nothing.
Okay, and I just want to mention to everyone who might be tuning in that if you have any questions, please feel free to leave them in the comment section, and we will circle back around at the end of this Q&A with us. And, it's been said time and time again that, if you have a weaker immune system, you might be at a greater risk. Is there any evidence that diabetics are more susceptible to COVID-19? And if they contract it, would their symptoms be much worse?
Yeah, so the best evidence we have right now, and it's all still fairly preliminary. I know this has been going on for a couple months now, but still the evidence is still just kind of coming in. But a lot of the evidence from China shows that people with diabetes aren't necessarily more prone to contracting COVID, but when they do contract COVID, they tend to get a more serious case of it. They tend to have more complications. So they're more likely to need hospitalization, to need ICU care, potentially more likely to require intubation. People with diabetes, especially type 1 diabetes, can have a life-threatening complication called ketoacidosis, where the sugars get very high. You have an accumulation of acid in the blood. It appears that COVID might increase the risk of that. So actually contracting it, we don't necessarily know that it's a higher risk of getting it, but when you do get it, people with diabetes are more at risk for a more serious infection.
Okay, and obviously things have changed right now with patient-doctor visits. How are we managing patients right now, given the current state of things?
So it definitely has changed things. I know our office in particular, we're really trying not to have people come to the office except for in case of emergencies. A lot of what we do, luckily for diabetes, can be done remotely. It just requires a little bit of flexibility on both the provider's part and the patient's part. We love to be able to access someone's glucose meter to see what their blood sugars are. There are some sites that make that easier. Our office, not to promote any specific one, but our office uses a site called gluco.com, and it's a way to download most commercially available meters, and a lot of doctors' offices do subscribe to that. So if someone in our office is able to download or upload their pump or their sensor onto Gluco, I can see it. A lot of offices don't have that capability, and a lot of patients don't really feel comfortable doing that. So even if it's as simple as writing down your glucose numbers, and what I would recommend is almost making a table. Each line is a different day, and then you would have a different column for before breakfast, before lunch, before dinner, before bed. Because then if we're able to do a video visit, you can just hold up your readings, and it's really easy for me to look down and I can kind of locate problem areas. Even if it's not a video visit, even just having it organized that way makes it a lot easier, because you're able to say, okay, you know, on Monday, before breakfast was 90, before lunch was this. Having it written down is a lot easier and allows us to identify those problems. So it might not be something that everyone's used to doing on a regular basis, but little alterations like that can make a huge difference. As far as the actual visits, I believe all offices in the Rochester Regional system, as well as most of them out there, are able to do video visits. So anyone that has a smartphone or a computer, laptop, tablet with a camera on it, we can do video visits, and that's the way we're preferring it. We'd rather have the visits now to address problems now rather than push off those visits, because number one, our volume is going to be a lot heavier in a few months, because everyone's going to be trying to get their visits in. And if there's any high sugars now, we want to lower those as soon as possible to lower everyone's risk.
And I think that's really an important note to mention, maintaining that structure. If you have an appointment or scheduling appointments, not waiting because of that volume. Is that just a message that you want to make sure patients aren't, not following their normal routine and the structure that they normally would be going about?
Yeah, absolutely. So I would definitely recommend try to keep your diabetes follow-up visits. The nice thing is I believe most local insurance plans and most local healthcare organizations are actually waiving the copay fees for most of the video and telephone visits. Again, it's not universal, but I know at Rochester Regional we are doing that in our department. So if there's any kind of financial barriers, that shouldn't be an issue. So we really definitely want people to connect with us any way possible.
How beneficial has some of that technology been, whether it's the apps, the websites, the telemedicine, and how important and critical has it been in this time?
It's indispensable. If we didn't have access to the telemedicine visits, if we didn't have access to some of that technology, we just would not be able to manage our patients, just because we really aren't seeing patients in the office. So it's become really, really important. I've been very impressed with our patient population. People have been really flexible. Our patients using insulin pumps, a lot of whom never really downloaded it to the computer, have really taken charge. Once you get used to it the first time, it becomes a lot easier. So there's lots of staff out there that can help walk you through it if you're having problems. I think everyone has to just be comfortable with being a little vulnerable to not mastering technology. There's always someone there to help you through it. Even live webcast, sometimes we need a little bit of help, but we'll get there together, and we can definitely work you through it.
Yeah, you took the words out of my mouth there. We talked about exercise. Food is another important topic point for diabetics. How important is it for them to maintain, eating healthy?
It's extremely important, especially when realistically people aren't going to be as active. Diet becomes even more and more important. The nice thing about having to stay at home is it does allow more time to maybe try out some of those diabetic-friendly recipes you've been meaning to try, maybe do some of your own cooking, because as a rule, what you're making in your house is generally going to be healthier than what you're going to be picking up from a local restaurant. There are a lot of different websites out there. There's a lot of different resources available for diabetic recipes. One that I particularly like is called diabetesfoodhub.org. If you just Google that, it's put out by the American Diabetes Association. There are hundreds, if not thousands, of recipes out there. Very simple instructions. They're broken down by types of meal, and then most of them are fairly easy to make. So perfect excuse to go on there, come up with some new recipes that are a little bit healthier.
Awesome. Is COVID-19 affecting the availability of any medical supplies for folks?
As far as we're aware right now, from a diabetes perspective, there does not seem to be any disruptions in the supply chain. So we've been reassured by most of the larger insulin suppliers that they have not had any issues with their factories. And I haven't seen that personally with any of my diabetes medications. There are some related conditions, people that are on chronic steroids where there might be a little bit of a difficult time getting certain medications just because of the needs at the hospital. But for diabetes meds, it's looking very good.
Okay.
That being said, I usually recommend for people keeping a 90-day supply on hand is a great idea. It also limits how often you need to go out to the pharmacy. So contacting whoever manages your diabetes and asking for 3-month supplies, including test strips, lancing devices, alcohol prep pads, pen needles that go on the insulin pens. All of those are really important to have extra supplies on, because even though it's not a problem now, who knows what might happen months down the line.
I know you mentioned keeping track of levels, whether putting a chart, making a list of those day to day. Is there anything else that diabetics should be doing at home that might be different than what they normally would be doing?
And generally, maybe checking their glucoses a little bit more frequently is recommended. How often really has to be specified to the patient. People who are on 4 injections of insulin a day, ideally, we usually ask them to be checking their glucose about 4 times a day as well. People who are on oral medications that won't cause low blood sugars, maybe they don't need to check at all, but I definitely would recommend reaching out to your diabetes provider, and they can tell you how often to be checking. If people are noticing that their glucose numbers are persistently high when they weren't in the past, it could be an early sign of an infection. Not absolutely, but it's possible. Alternately, again, the glucoses might be higher because they're not eating the same way or because they're not exercising, but you need to get the data in order to realize that there's a problem. So don't wait too long. If you're not feeling well, if you're noticing a problem, definitely reach out to your provider sooner rather than later.
And do you have any additional advice to anyone at home that has diabetes? Obviously, everybody is handling what is happening right now in the world differently. So any words of advice for them?
So I think a lot of us are focusing on what people with diabetes should be doing differently than everyone else. And I really want to stress that they should be doing a lot of the same things that everyone is doing, okay? The standard precautions of, again, social distancing, keeping 6 feet from one another, really trying not to go out unless it's absolutely necessary. Ask for help for family and friends. I know personally, I have a mother that has type 1 diabetes, and she really likes to do everything herself. And I think we've had to be a little bit more insistent in saying, Mom, why don't we pick up groceries for you? Allow people to do that for you, because it does lower the risk. Eventually things will go back to normal, but really trying to minimize the trips out. When you do have to go out, the CDC is starting to recommend at least consideration of wearing a mask when you go out. Trying not to touch your face, especially when you've been out. Washing your hands more frequently. So especially when you come in from being outside, being in contact with others, making sure you wash your hands is absolutely critical. So those are going to be the big ones. Really just taking care of yourself, taking those standard precautions.
And is there anything else that I'm missing that you wanted to make sure to get across to people tuning in at home?
So, this time really, it seems really discouraging, and I think people are getting really disheartened and they're focusing a lot on the negative. This is not the time to panic. People should be prepared, but I don't want them to be petrified because of this whole situation. We're going to get through this. This is definitely an adjustment. We're going to be doing things differently. You're going to be seeing your providers differently. You're going to be seeing family and friends differently, but we're going to get through this. This is not the time to isolate by yourself. So I said this once before, just because we have to distance doesn't mean we have to disconnect. So we want to make sure that you're talking to loved ones. Check in on those people with chronic conditions like diabetes. Talk to your family, talk to your friends, talk to your providers. That's the best way that we can all get through this together.
And I know that you mentioned in the beginning of the interview earlier that if someone with diabetes was to have COVID-19, symptoms could be worse. Should they be, I know you mentioned obviously going to your doctor provider right away. I guess especially since those symptoms could be worse, should they really be paying close attention to that and contacting you as soon as possible?
So it's difficult because we want people to get seen and cared for right away, but at the same time we're telling the same people stay away from hospitals at all costs. What I would say is if you have questions, use your primary care office or your diabetes provider as a first line. This is something where even though sending an electronic message might be tempting, if it's something serious, I really would call. If it's minor things, like if you have a minor low blood sugar at home, we can walk you through how to manage that. If it's something more severe, again, if it's a low blood sugar where someone's not responding the right way or they can't eat safely, that's a situation where you have to go to the emergency department. If they're running consistently high, getting dehydrated, not acting normally, you have to go to the emergency department. If there's any difficulty breathing where they really are having a difficult time catching their breath, those are times you have to go to your emergency department. But for the minor symptoms, minor shortness of breath, minor cough, that's when you want to call and get the advice right away, and then your medical professional can direct you.
Dr. Quartuccio, thank you very much for joining me here this afternoon. Thank you for everything that you're doing. I'm sure the folks at home really appreciate you taking this time.
Thank you for having me. Thank you.
And again, if anybody has any questions, I didn't see any in there while we were going live just now, but even if you have any after, we can try and answer some of those for you at a later time. Again, thank you for taking the time to be with us, and we will be having more of these Facebook discussions on different topics as the weeks go on, and we're all still practicing safe social distancing and staying at home. So everybody take care, and we'll see you next time.